Thank you, Mr. Speaker, and I appreciate the comments. I was going to be cool, calm, and collected, of course, as I normally am in the committee, Mr. Chairman, as you know, and but of course, required to respond to just a couple points. I agree with my colleague who just spoke that we want to get this fixed. We want to do it now, and I'm going to talk about the importance of paying for it. But the public has to understand that we're 39 seats in the minority. The only bipartisan vote was the no vote on the health care bill. And for the protestations that Republicans only one vote, the reality is you could do whatever you want. But the bipartisan vote was no against the health care bill. Why? $500 billion cuts in Medicare. We talked about this yesterday in the committee. Not on Medicare Advantage, hospital cuts, doc cuts across the board, tax increases, $1 trillion in new spending. And you think if you're going to spend $1 trillion more, you could have fixed this. In fact, you all promised it. But because of the policy and the politics, you had to accept the Senate bill that really didn't do it. The promise you made to some doctor organization, you could not keep. That is why we're here again. And we know the CBO, we know the CMS actuary says premiums are going to go up. Benefits are going to be cut. Our healthcare system is going to change because we're going to migrate away from the employer-based healthcare system. Some of us believe that was the intent of the law that you passed. So there is an important part of this debate. First of all, we have a $13.5 trillion debt. Now, I'm not going to lay that all on my colleagues' shoulders because a lot of it's our fault. We get it. We were put in the minority because of our frivolous, reckless spending. You better be very, very careful that you're going down that same path. $13.5 trillion debt makes the argument to the public today that we have to pay for things. We have to pay for the services that we think are important. And all the other things on the spending side that this was connected to, we didn't pay for it all. And I don't know about you, and in your districts, my folks are saying, stop going into debt. Stop obligating yourself to things that we cannot pay for. Stop mortgaging our grandchildren's future. So that's what this is about. That's why we support this bill. Because you know what? It's paid for. Maybe we are getting the message. Maybe we're turning the corner. Maybe we realize now that if it's important enough to have, it's important enough to pay for. This costs $6.4 billion. It is a 2.2% increase in reimbursement levels. If the bill is not passed, Medicare physicians will face a 20% reduction in reimbursement rates, and we want them to see our seniors. We want them to be paid for their services. It's curious. It ends in November. Things happen in November. December's not paid for. January's not paid for. In fact, as we went along this process, we had month extensions throughout this process, instead of addressing the issue early on. And I'll be honest, Mr. Speaker, we'll accept a lot of our blame for the position we're in. But we're not in the majority now. And the public has changed. And they say, start paying for the services that you think are important, whether it's discretionary or it's entitlement. And that's why we support this bill. Doctors need it. I appreciate my colleagues and their support in the debate, and I yield back the balance of my time.